As we do each week, we'll begin with a Berks County COVID-19 data report. It's presented by Brian Gottschall, the director of our Berks County Department of Emergency Services. Brian Gottschall.
Good morning, Commissioners. Thank you. We have a couple things to talk through, some new information as well as some clarifications in state reporting, so we will jump right into it. Our first slide that we always look at is our 14-day smooth case count. And we added a little bit of a zoom box, for lack of a better term, in this week's window because the detail on the right edge of the report is very hard to see. I'm sure that folks caught in the local news media outlets that beginning over the weekend, the State Department of Health began comporting with federal requirements about case reporting. Prior to that, if you had been a positive COVID case, and then were cured, were no longer COVID positive, and then contracted COVID again a second time, you were not counted. However, the national reporting standards have now changed, and the expectation is that if there's a 90-day window between your original contracting of the disease and a follow-up infection, you are counted a second time. And a period of time of that was rolled into the weekend, which caused this very vertical spike that we see in our case count in this reporting period. I would expect that, we kind of went from this period of, for lack of a better term, new normal, where we saw a very flat case count running around 2,000 cases over a 14-day period. And then suddenly we jumped up to almost 3,000 cases over a 14-day period. And that will now, I believe, be our new normal until there is a significant drop or, again, God forbid, an increase in our community. So we just wanted to very clearly explain why we saw that vertical jump in cases and now a few days of stabilized at that new higher level, and we'll see how that pans out over the next couple weeks. Our case count in the county did go up over the last 7-day period, a very small amount. Again, universally throughout the region, almost all counties saw an increase in case rates over the 7-day period, the exception being Philadelphia, that actually dropped slightly again. Philadelphia continues to be the only county in the Commonwealth that is not in the high community transmission rating. And as we've said over the last couple of weeks, we continue to see improvements over the Deep South and the Far West. That is not in any way, shape, or form being reflected in the Northeast in the way that we had hoped it might be, in the belief that as the South came out of the Delta surge, we would too come out of that Delta surge. It's getting a little bit scary as we're starting to go into the winter season where people are not out and about, where there's not a high degree of ventilation and air exchange, and we've not gotten our case count on a regular basis down low to begin with in order to go into that season where we would anticipate seeing an increase no matter what. Our pediatric cases in the 5 to 18 range did jump up over the last week beyond where they were for the 4 weeks prior to that. We continue to see a flat rate in the 0 to 4-year-old case range. Our hospital numbers are kind of flat. It is interesting to note that in the more serious cases in the ICU and the cases on ventilators, we're seeing a larger percentage of those folks being individuals who are in fact vaccinated. So if you look at the very last number under each week, you see the percent vaccinated in each number. And we went from around 10% of our ICU cases and our cases on ventilators being those who are vaccinated to almost 50% in each of those categories in the last week. Again, something that we have to keep looking at, hope that it's just an anomaly and we see more of a return to normal in following weeks. Unfortunate slide, but not a whole lot to say about this one. We continue to see a slow rise in COVID death rates. Again, we don't see a slope in the curve like we did back in the end of December, beginning of January of this year, where that slope was very steep, but it is a slow, steady rise over the last number of months. With respect to vaccinations, we continue to make very slow progress in pretty much the same places we are, approaching that 70% number in Berks County, having just exceeded it in Pennsylvania, and looking at those who have had at least their first dose of vaccine. we see that we're on track to get past that 70% bar. As we approach the 70% bar, we do have to remember that, you know, it's somewhat inconsequential at this juncture. While it's a goal that we've been looking forward to, now that we understand that it's unlikely to find herd immunity in the community based on large vaccination, and we now understand that vaccination is really an individual and personal thing that's about protecting the individual who's been vaccinated more so than protecting those around him. You know, it's still important, but it's not nearly the goal that it was when we first said it, or I should say when CDC and the governor first said it. These are some new slides I wanted to take a look at, and this is kind of a direct answer to people who, again, the volume of the folks saying that COVID is really no worse than influenza, and why are we more concerned with it than we are with annual influenza. We really want to show some data that talks about that, and I'll try to explain these slides as clearly as I can. Of course, on the left is hospitalizations, on the right is deaths, and this is across the United States. The kind of purpley blue line at the bottom that is very flat is among those who are vaccinated. The solid blue line is the entire population, consideration to those who are and are not vaccinated, and the dotted blue line is those who are unvaccinated. And what we can see here is the period of time of August of 2021, and per 100,000 people, the number of hospitalizations and the number of deaths per 100,000 people that were created by COVID in each of those categories of vaccinated, unvaccinated, and the population as a whole. And we compare those numbers to the dots to the right of the graphs. And the dots to the right are defined in the key all the way on the right-hand side of the page. The solid dot is representative of all kinds of cancer. The open blue dot is representative of traffic injuries. And the open black and solid purple dots are representative of influenza. And what we're looking at here in the purple dot, we're talking about influenza on average over a decade is the purple dot. The worst case year of influenza over the last decade is the open black dot. And as you can see, for those who are vaccinated, in the month of August, the COVID hospitalizations and COVID deaths are significantly below or at the level of all of those other public health threats. But for those who are unvaccinated and for the population as a whole, these numbers far exceed those other public health threats. And therefore, folks who would say that, well, COVID is really no different than influenza, they could arguably be right in saying that if they tacked on to the end of that statement for those individuals who are vaccinated. But for those individuals who are unvaccinated, and therefore our population as a whole on average, COVID represents a much greater impact on hospitalizations and deaths than those other public health concerns that we would compare them to, including influenza. This is just another slightly different way of looking at that data. Here we're looking at a representative week of the end of August in 2021, and the impacts to the entire population, the population with consideration unvaccinated or vaccinated, versus influenza and those other public health threats. And this is, again, these impacts per million people, trying to control for population and make the numbers understandable and reasonably small. But if you compare these boxes in both their size as well as in the actual objective numbers within the boxes, again, you see these impacts on the population of the United States as compared to those other public health concerns. And I would hope that anybody looking at these numbers would acknowledge that there's a very big difference between the impacts of COVID and the impacts of influenza, whether you look at it over a 10-year average or whether you look at it in the worst year of the last 10 years. Last slide with respect to those comparisons, or not really with those comparisons, but talking about the other public health threats. And I think that we're going to begin looking at this on a weekly basis because it is going to start becoming meaningful with respect to comorbid conditions of people who contract COVID and also have influenza. And it's also going to begin driving impacts on our hospitals and healthcare systems as they start to see the effects of influenza that they see on an annual basis. So each of these lines is representative of the number of cases of influenza in Pennsylvania. This is not national, this is in Pennsylvania, over each one of these years. And we can see, I hope you can see, given the screen presentation, the very flat yellow line that goes across the bottom of the graph here. This is influenza in the 2020-21 season, where we were all masked, we were all practicing social distancing, and as a result of our efforts to control COVID, really controlled influenza also, and saw a very low influenza case count throughout the Commonwealth in that whole year. Over here on the left side, the little circled dots are the weekly data points of our 2021-2022 COVID season. And we can see that this season is already shaping up, laying right over top of our 2019-2020 season, which peaked out as being our second worst season of influenza in the last 10 years. Clearly, the concern that we're trying to enunciate here is that we have a severe influenza season on top of our COVID issues. And this is, we go all the way back to, 14 days to stop the spread and all of those efforts. This is really what we were trying to do in the first year of COVID, was avoid COVID surge on top of influenza surge. And if you recall, we were very lucky in that COVID started at the back end of the flu season. And then we were able to abate influenza with our mitigation measures in the 2020-2021 year. But now we're at the 2021-2022 year, where much of the population has become tired of COVID mitigation measures. They're not being practiced in the way that they were last year. And this is really setting us on a course to see a significant influenza impact on top of our COVID impacts. And this is what we're really asking the public to be cognizant of, and to help our healthcare community in controlling both the spread of COVID as well as the spread of influenza through the implementation of the mitigation measures that we've all come to know and understand over these last 20 months. So I'll pause there, commissioners, if there are any questions. If not, I'll proceed on, but that's the end of the new stuff that we wanted to look at this week.
Any questions for Brian?
Nope.
Thank you. Go ahead, Brian.
We wanted to take a look at how things are going at the Berks Cares Clinic. Again, we're operating this clinic in Muhlenberg Township in the Walmart Plaza in conjunction with Penn State Health Systems. The COVID clinic, or the COVID vaccine clinic, there is open Wednesday through Saturday from 9 to 2 by appointment. We prefer that people not just walk in. It helps them to control their needs for staffing and vaccine. But we have aggregated data from the opening of the clinic on 10/28 through 11/8, where we delivered 447 doses, but we're not tracking the types and age groups moving forward. We are going to begin reporting out by age group and by type of dose, a booster, first dose, second dose, whatever. And what we can see is that the largest preponderance of the vaccines that are being delivered at that clinic these days are booster doses and doses for immunocompromised folks who are seeking their third dose. About 277 doses in the last week of reporting. That's great, but the bad news is that's only about 14 doses per hour. So we are making investment in that operation for a fairly low number of doses out the door. Penn State is prepared to ramp up that operation if there's a community need, but at the moment we're not seeing a community need. We're not seeing people wanting appointments at a larger percentage than what they can make appointments available. We're going to continue to monitor that, and we want to continuously remind the public that that resource is available there to them if they would choose to take advantage of it. Excuse me. This is a recap of the recommendations that we showed beginning last week, trying to summarize for each of the age groups what the types of vaccine are that are available to them, and how many doses of each of those vaccine are necessary in order for the age group to be fully vaccinated. And this is a little bit of an adjustment. Again, we're always trying to improve the way we present this information to make it easy for folks to understand. So we break out how booster doses work by vaccine type and by age group, and then use the colors to highlight the CDC recommendations for whether folks should get a booster or whether they're just eligible / may get a booster, the difference in green and yellow. So again, if you've received Janssen and you're 2 months past your Janssen, no matter what your other conditions are, just if you've gotten the vaccine, CDC says that you should get a booster after 2 months. Gets a little more complicated when we get down here into the mRNA vaccines for Pfizer and Moderna. In either case, whether it's Pfizer or Moderna, the area of interest is after 6 months, but then it breaks out by age group and other compounding factors, whether you are in a should or a may condition. And I won't read through each of those. I think they're fairly easy to understand on the slide. And of course, folks that have any questions can reach out to their healthcare providers, a pharmacy, to explain their specific condition and understand whether they should or should not be pursuing a booster dose. So on the horizon, really nothing to talk about today, but kind of news that we expect to be coming is, number one, the opportunity for universal boosters for everybody who had mRNA vaccines, irrespective of their compounding conditions, to be able to seek boosters if they would choose to get them. And the potential review of a new drug offered by Merck Pharmaceuticals called Molnupiravir. Quite a mouthful there, but this is the pill that we've heard talked about on the in the news media that would allow folks who have contracted COVID and who have compounding conditions to take this antiviral drug at home over a 5-day course in the hopes of avoiding hospitalization. And the preliminary data, of course, looked good for this, but it is all being reviewed by the FDA and will ultimately have to have approvals before it would be available outside of clinical trials. Again, we believe that we're going to hear something from FDA about that by the end of the month. Whether it's good news or bad news, we believe we're going to hear something. And as always, wrapping up with the advertisement for doyourpartberks.com, where we hope people will go to find information about COVID vaccines, and very soon COVID testing information also that's going to be added to that site. So commissioners, back to you. Unless there are any questions, that's a wrap for me.